any other exciting updates that patients and families should know about related to lung cancer? Maybe things that are in the works that we may hear about in 2023?
Yeah, I say, for example, liquid biopsy. I was mentioning liquid biopsy, no? And we are focused obviously in patients that have advanced disease or when they have this disease that is already confirmed. But we are now moving the tools that we have to identification of of cancer using liquid biopsy from the very beginning, so we can use in minimal residual disease that are patients after the surgery. And I think I'm here answering one of the questions that we have in the chat, that this minimal residual disease is the quantity of tumor that sometimes we are not able to see in the images, or is very teeny and we have equivocal information. The possibility to discover the patients that after a surgery have the possibility to recurrence or have a comeback of the disease is really important. And also we are looking for early detection of lung cancer, trying to identify patients with the high-risk populations that they are maybe having or having the opportunity to be in lung cancer screening because they are smokers or because they have other characteristics in top of the smokers, that we can also use the liquid biopsy there. But one of the most important messages that I want to say, because I mentioned here smokers, and I want to remind that we have a big proportion of patients, around 20-25% of the patients, that they never smoked, and they can develop lung cancer. So we have a motto, I would say, if you have a lung, you can have it, because we want to break this stigma that lung cancer have, that only patients who are smoking. Obviously, smoking and tobacco are related highly with lung cancer, but also we have patients that are secondhand smokers or they have other causes of lung cancer. So we need to be aware and we need to try to get attention for that, because in this special population of non-smokers, we know that there are special characteristics that we can treat them completely different. So it's very important that we identify those patients as well.
I really appreciate you sharing that, Dr. Rolfo, because as I'm sure you know, there's a lot of stigma associated with lung cancer and an assumption that, you know, if you have lung cancer, then that automatically means that you are a smoker. And not that, you know, we know that people who smoke, those are challenges, but to just acknowledge that not everybody with lung cancer is someone who is a smoker, and also that the treatment approach may be different. So I really appreciate you pointing that out.
And actually, Dr. Rochester, you know, this stigma was causing several domino effects. We have less funding for research. We have less support from the community sometimes, like other tumors have, for example, breast cancer. So if we are looking specifically in lung cancer, the quantity of women that are dying or are going to a diagnosis of lung cancer is very impressive, and actually is killing more people sometimes than other tumors. So we need to be very careful with this stigma, because we need, and this is a call for action, no? We need more funds, we need more support from the community, because this is a very important area that we need to research.